Hello, today we're going to do a full battery of cranial nerve testing here on my patient Matthew Page. We're going to start with olfactory, which is cranial nerve 1. Matt, go ahead and close your eyes and then include your left nostril for me. We're going to present this to his right nostril. Matt, what do you smell?
Cinnamon.
Good. All right, include the other nostril. What smell do you smell this time?
Cinnamon.
Good. And were both smells about equal?
Mm-hmm.
Good. All right, we're going to check cranial nerve 2, which is the optic nerve. Many ways to check the optic nerve. Today we're going to do pupils, but we could also do VAs, computational fields, color vision. So we're going to look in dim illumination. His pupils appear to be about a 5, equally round, OEU. We're going to do direct illumination. Matt, just go ahead and look at that letter out there for me. Actually about a 6 in dim. Constriction down to a 3 directly on the right side. Down to a 3 on the left side. And now we're looking for consensual, so we're looking at the opposite eye the light is shining in. Consensual response, OD. Consensual response, OS. Now we want to look for an APD. Good. Maintaining constrictions, minus APD. Alright, so 3, 4, and 6 innervate the ocular motor muscles. So we can test them all at the same time. Matt, what I want you to do is look at the tip of my flashlight here. Just follow them with your eyes. Let me know if you have any pain or double vision. Any double vision could indicate that there is a palsy in one of these 6 ocular motor muscles. Any double vision? Any pain? Excellent. We're going to move on to the trigeminal cranial nerve. We're going to start with the motor innervation of it, which motivates the chewing masseter. So Matt, what I want you to do is just kind of clench your teeth and kind of just pretend like you're chewing. And we're going to feel for the masseter. Response feels equal. Now we'll check for the sensory innervation. We'll use both a blunt and a sharp pressure to test to minimize and maximize the amount of fields that are activated. See how acute his sensory innervation is. Matt, go ahead and close your eyes for me. Tell me if you feel a dull or sharp pressure.
Don't.
That's ophthalmic.
Don't.
Maxillary.
Sharp.
Submandibular. We'll repeat the test for the left side.
Don't. Don't. Sharp.
Okay. Depending on how much you like your patient, you might choose to do the sharp side more often. Alright, now for the cornea test. The trigeminal also innervates the sensory of the cornea, so we do a cotton wisp test. So now what I want you to do is just look straight forward for me and tell me you can first feel this on your eye. You can also look for reflex blinking. There. Good. Same thing here. There. Good. Alright. Next we're going to take care of the facial nerve, which is primarily motor. So we want you to close your eyes for me. We're going to attempt to open his eyes. Okay. And then we'll do that for the last one. Good. Okay, I want you to puff out your cheeks. We're going to test the buccinator here. Stand to the side on this one. Good. One more time. Okay, they're both equal. Then Matt, go ahead and smile at me. Beautiful. And frown. I knew you couldn't. I knew you couldn't. Okay. Both the smile and the frown look equal. Then we're going to check number 8, which is acoustic. We're going to do the Weber's test first, which is air conduction between both ears.
I hear it.
Do you hear it more on the left side or the right side?
Equal.
Equal? Good. Alright. Now we're going to check bone conduction versus air conduction on the right side. Matt, tell me when you can no longer hear this.
There.
Good. You still hear it there?
Yes.
Good. Air conduction is greater than bone conduction on the right side, which we'd expect. Same thing here. So we no longer hear this. Good. You still hear it there?
Mm-hmm.
Good. And the air conduction is greater than bone conduction there. So that is cranial nerve 8. Then we're going to check 9 and 10 together. Alright, Matt, go ahead and open your mouth for me. We're going to check a gag reflex, which is cranial nerve 9. Okay, good gag. And then we also want to look in the back there to see the uvula is in the middle. Go ahead and open up again. And it looks slightly deviated to the right, but that's grossly normal. Okay. Now we want to check cranial nerve 10. We've already heard Matt talk today, so we know his voice isn't hoarse. Go ahead and say ah for me, Matt. Ah. Good. Okay, so we know that cranial nerve 10 is functioning. Now we want to do the spinal accessory, which is cranial nerve 11. Matt, I'm going to put some pressure on your shoulders here. I want you to shrug your shoulders up. So you're going to feel that both sides are shrugging equally, and they are. And then same thing here. I'm going to put some pressure on your cheek and turn your head towards me. Good. Same thing here. Good. All right. And the last nerve that we're going to check today is a hypoglossal, and it is 12. What I want you to do, Matt, stick your tongue out. What we're looking for is that the tongue is coming out equally in this midline, and it is. Then we're going to check how much pressure you can put against his cheek. Go ahead and use your tongue. Good. And then here. And those are normal too. And that is cranial nerve testing.